Let's talk about how we do sensate breast reconstruction. This is an emerging area within reconstructive surgery. I do them as part of my practice, and I think that they are super promising. I will start the conversation by saying that the data is early and emerging, but promising, especially for implant-based reconstruction. When you have a mastectomy, the nerves that supply your breast have to be cut because they're going into the breast tissue. The main nerves that supply your breast are your intercostals, which come from over here and along your breastbone. Sometimes the ones along your breastbone are safe to leave behind, and that's why some women after mastectomy retain some sensation here. But the ones on your lateral sides have to be cut. They're going into the breast. And that's why women have decreased sensation specifically along the lateral aspect of the breast after a mastectomy with or without reconstruction. So what we can do at the time of the mastectomy is identify those nerves that are going into the breast tissue, typically the fourth or fifth intercostals. Those nerves are the width of a hair, so they're very small. And then we can find them going into the breast, kind of tease them out, get as much length as possible. So now you have this little short nub of a nerve that used to supply the nipple and the areola. That's where the fancy microsurgery comes involved. So then we get a cadaver nerve graft. So yes, it was taken as part of organ donation. And then we hook it up to the nerve, and then it kind of comes along the implant to underneath the nipple and the areola, and then we hook it up underneath the nipple and the areola. It's not instantaneous. It takes a long time for that nerve to regrow. Nerves regenerate at a rate of about 1 millimeter per day. And for an average sized breast, here to here is about 100 millimeters, at least 100 days. So it does take a long time. Now, I have my patients start a sensory protocol after surgery that involves some light touch, using things like cold movement to kind of retrain the brain like, hey, yeah, I know we took the original nerve, but we gave it a new nerve, so start doing your activities. Now, even if this sensation doesn't work, I think that this has real promise for preventing post-mastectomy pain. This approach, where we're kind of giving the nerve a new job to do, is something that we do in limb amputation to help with the pain associated with amputation. And like we've talked about before, a mastectomy is an amputation. So I think that this is a huge area that we need to study. It has a lot of promise, but that's another thing that I talk to my patients about, where even if the sensation doesn't return in a way that we want it to, if it can prevent your post-mastectomy pain, that's a win. That is life-changing. Let me know what questions you have about sensation below, and let me know if you've had this procedure.